invited the various church leaders to meet with them, and we're quite appreciative of the fact that the church leaders have come out in strong support of the President's call to reduce the numbers of people in meetings, and that is church gatherings, to 100 or less, and with many of them agreeing that they will not have large Easter service during Good Friday weekend. It is important for us because these areas are where a large amount of people gather. It tends to create an avenue for more people to be infected. So from that point of view, we have therefore been very appreciative of the gesture of support and commitment that has come from the churches. We also, they actually went out and made a message which I thought was actually quite profound, of saying to people they must not stop praying, but they must pray from their homes. They must turn their homes into synagogues. They must turn their homes into mosques. They must turn their homes into churches. We want to echo this message because we believe that such a message is important for our people to understand that we are with them as they worship. We will be with them as they worship at home. We will be with them because their stay at home is a contribution in the fight against this spread of coronavirus. And we want to therefore thank them for that. And we also did indicate to the members of the church as the leaders that leaders and society must not fear the virus and panic. But we need to be realistic about it, that in terms of scientists' estimation in the projections that they show, they indicate that the nature of the viral infection is that it will ultimately can affect up to 60% of the population. Doesn't mean that they'll all be affected at the same time. Doesn't mean that they will all have a serious illness. It just means that the way the viral infection spread, that is likely to happen. So we have to understand that the virus, as it has come now, is going to be with us for quite a while. In fact, it's going to be one of those viruses that our bodies have to build new immunity to be able to deal with and defeat. And so, again, it's a reality we must face, but it's not a reality that says we're now facing an apocalypse. We have seen how united action and determined, firm decisions have made a difference in some of the countries such as China, where in the past few weeks we have seen that they've not increased to get new infections. We have also not increased to actually see more deaths, but in some of the countries we're still battling. The WHO has actually declared that Europe now is the epicenter of the infection. Now South Africa has also seen a number of people who have been infected would have largely come from Europe and of course different parts of the world. So as we sit here today, we are sending a message out to our people that we must face this as a reality, because the approach we are taking is that it was a matter of time that the virus reached South Africa, and in so saying, we also want to say that the nature of the viral infection is that when it spreads through the droplet infection. So simple hygienic means are important. So when people cough or sneeze, to block their mouth and nose so that it doesn't spread to the next person, but also to make sure that we wash our hands. So we've intensified hygiene in a number of areas. We've also made sure that the information goes out to as many people as possible. We spoke to various schools now, and we are encouraging teachers to teach our children as early as now, as young as they are, to understand that you can actually do something to fight the coronavirus. So those messages become very, very important and strong, and we are saying that it's important for all of us to be mobilized to fight this infection. It's something that all countries are doing, and we have actually been pleased to see that the government has taken firm steps to restrict certain movement that tend to predispose to the spread of the virus. And in so saying, we would like our people to heed the call to make sure that we follow all of these precautions. It's important as well because that's really where the virus will be defeated. It is not in treating one patient that we are going to deal with the virus. It's in preventing it from spreading too fast. And we have said our approach is we're slowing it down, we want to flatten the curve. In other words, the numbers of people who have got the infection must not rise so rapidly as to overwhelm our health system. They must rise slowly so that we can cope with those who will need to be treated and be dealt with. And in the experience we've seen from other countries, the virus is spread in crowded environment. In the Chinese situation, about 75% of the spread happened within family settings. And therefore, but in some instances, we've seen that large crowded gatherings are actually a perfect place where the virus spreads. The church in Daegu in South Korea is one example. The Diamond Princess is another example where a large number of people got infected just from few individuals, as it were. So we want to reiterate the message. But it's important also for people to try and spread the correct information. Fake news undermines our effort. Distortions and creating of pessimism and cynicism actually it distorts the message. And therefore it's important for us to say we need to discourage people who make jokes about this in a way that ridicule efforts to actually correct the behavior of all of our people. We were talking to the religious leaders, and they were sending a very strong message that on top of prayer, people must continue to focus on hygiene, cleaning, washing their hands, using disinfectants, and also making sure when they cough, they block their mouths. This is important so that you do not have anybody who's going to stand out there and say that only with prayer they're going to actually get rid of the coronavirus. We have picked up those kinds of messages and want to dismiss those kinds of messages and say we would like to plead for everyone out there not to give us messages that are going to confuse the public in this regard. Having given you the figures, I do want to focus on what the situation has been in the Free State. We have already gone to address the legislature. We have also gone to address the professionals. We are the clinicians, the medical specialists, the nurses, the virologists, the private and public laboratories. We've done all of that because we believe the leadership should have a sense of the state of the epidemic, of the pandemic in their own environment. We have also asked that the Premier should activate a provincial command council so that they must operate on the basis of the National Disaster Management Act. There are specific areas which we have had to take into account in the case of Free State. Of the first 5 people that were reported, 2 of them are people who came from Texas in the USA, and another 2 came from Israel, and another 1 came from France, and they came here around the 9th to the 11th of this month. They came to a church gathering, and the church gathering had a number of people, between 200 and 300 people, and the concern that we have had is that whilst they were there, then somewhere along the line they developed symptoms, and therefore they actually went to a doctor who in the meantime was able to take the necessary precautions, put them in quarantine, and then of course the test came back positive. There were other people who were with them who had come to the conference, who never had symptoms, who had since left and went to Madagascar. Now these 5, when they were found to be positive for coronavirus, have actually been quarantined in the BNB which they were residing in. The management has been met, and therefore in conducting them together with the staff, that means now the entire staff in that BNB has to be put under quarantine. We have therefore activated a whole program of contact tracing to find the members of the church so that they will be evaluated in terms of their risk profile, and then some of whom will have to be tested immediately, and others will probably have to be watched depending on the assessment of the tracing team. We have therefore in the process discussed with the provincial government that the numbers of tracing members of the tracing team needs to be reinforced. We have therefore called upon for the support and reinforcement from the South African Red Cross. I had a meeting early this week with the director of the International Federation of the Red Cross Societies, and we have agreed that they will work with government in supporting the fight against coronavirus, where they will be taking some of their experience from the work they are doing in China, in Italy, in Spain, and other countries in Europe. We have already the manager here of Red Cross in the province. They will be reinforcing with immediate effect the current provincial team with about 285 people who are volunteers who are going to be involved in contact tracing. We have set this weekend as a target to rush out and get as many of those members of the church so that we are able to actually start the process of screening them, testing them, quarantine, and make sure that we limit the further spread of the infection. And from that point of view, we believe that when we send the message out, we're going to be appealing for members of the church to identify other members so that those members should be met by the team, and therefore we must be able to do the necessary screening. So we have actually dispatched a senior expert from the National Institute for Communicable Diseases to come and reinforce this effort. They'll be landing here today. We have also asked the National Health Laboratory Services, which is the government laboratory service, to dispatch a mobile unit to come into this province to face a situation like this one. We can't treat it like what has been happening in other areas. In most of the areas, it's one individual and a set of contacts, and they're dispersed from different towns. Therefore, we've got different teams that are dealing with them. Here, we're dealing with a concentrated set of contacts. Therefore, we're going to bring a whole operation that's going to round up as many as possible of the contacts, so that we can actually make sure that we can account for as many of them by the time when the weekend is over. We have also briefed the president, who is again as the commander of this whole operation, is actually going to be briefed as soon as there are new developments in this matter. So we want to thank the Red Cross for assisting us in this regard. We have also gone to we call it Brandwag School. Here we have another set of South Africans. The one is a South African who had visited Italy, who came back and tested positive. That one is not different to the other cases that we have found in the other parts of the country. But the second one is a mother of 2, who is a health worker, has no history of international travel, but she works in a number of private hospitals. So because of the work she does, we have looked at it. we have looked at it, and then we've already identified the numbers of patients that she looks after. So they will now be treated as the first set of contacts, and they'll be screened and they'll be tested so that we can identify the possible source of the infection. But the real concern is that her 2 children are attending Brandwag School, and one in grade 1, one in grade 2. And so we've actually identified that since the children did develop symptoms, they have also been taken for quarantine. They also will be tested. They've actually been tested. We're waiting for the results. At least by latest, by tomorrow, we'll have the results. Now, the parents were asked to come to the school. We met with the parents. We've explained to them how we're managing this viral infection. We've also met with the teachers, and we made sure that no one panics. We've appealed to the teachers to actually teach the children on how to deal with and prevent the spread of the infection. In fact, we must not take that lightly. Children catch up very quickly on such messages. And I've seen this because my own experience, I even had to do a video with my own grandchildren who were actually showing me how you do it. They actually understand, and therefore the parents and the teachers must actually invest in training the children, explain to them what is coronavirus, what it means, what it does, and that they must not fear it, but they must know how to prevent it. So I've shared that story with them, that it's important for them to teach the children. In the meantime, we've sent a whole team of professionals who are already in the school as we speak. They're going to divide the school into 2 groups. There's a group of all the parents who are in classes that are not affected or who are not part of these 2 children. Those need to be counseled, and then we have to just detect if there's anyone who's got symptoms. They're unlikely to have been affected in any way because the school has got a large number of children, about 700 of them. Then we'll go to the classes where these 2 children are. And again, the message to them is they should not panic. Because the results are going to come back, if the results come back negative, then we will only just watch symptoms for those children just to make sure that none of them are affected in any way. It's most likely going to be flu on the common cold with those. But then the affected children, negative as they will be testing, they will stay in quarantine for 14 days, and then as long as they are with their parents, their mother will stay with them and be treated until she is also negative. That sorts one problem out. But if they are found to be positive, changes the game quite a lot. Then the children now become the first line of contacts. They must then be now quarantined in their homes, and then they must then be tested. Then we now wait for their own results, and therefore the cycle keeps continuing just like that. So with that approach, the nurses and the professionals that are already starting the work are explaining this process to the parents. The provincial government is already looking at accommodation so that if there are people whose circumstances may not allow them to be quarantined in their homes, they need to be moved and quarantined in the area where that will be possible. So all of this is work that's going to happen today. Now, having addressed the provincial legislature, I can also indicate that all those parties, political parties, have all agreed to work together. We'll be submitting to them, we'll be supplying them with material which talks about the coronavirus so that they can actually assist in spreading the message, and are very keen to participate at that level. We've also indicated to them that they need to share their views and suggestions with the Premier so that we can all work together as a team. So we also have asked that the Premier should meet with the councillors, the mayor and the councillors, so that they must also spread the message. That meeting will take place this afternoon. Then we've also asked that they must deal with the religious leaders. The religious leaders, it's important for us to appeal to them that this weekend, no large gatherings. they must assist us to limit the numbers as has been requested by the President, so that we don't have new areas where there's an explosion of potential infection. We also want to encourage the church leaders and the communities that those who have got symptoms of any cold, sneezing or cough or fever should stay away from being part of the church or gatherings, because that will help to actually make sure we limit the risk to everyone else. But that those who are in the church that would have been affected would then need to identify themselves so that we can assist them with testing as well. That is the approach that we're going to be taking here. Premier is going to be talking to you, and I was very pleased to hear that she has already got plans on what kind of major activities that have to be cancelled or postponed and so on, but she will actually explain that herself, and I'm very, very pleased with that approach. So the team led by the MEC and the head of department on behalf of the provincial government is going to be in the forefront, running to make sure that action is quite accelerated over this weekend. And I have been promised that, as I requested, I will begin to get my report in terms of the numbers of contacts that they are able to reach by the end of today, by the end of tomorrow, and by Sunday, so that we must try as much as possible. When it's still hot, we must strike at the iron that is still hot and make sure we reach out to as many people. I think it's important just to explain those particular issues. I also just met with the professionals. I was pleased to see that they are both from public and private. And yesterday, I also had a teleconference with the private laboratories, the CEOs of private laboratories. A lot of tests that have been done, probably over 97% have been done in the private sector. Therefore, the coordination between the public and private laboratories becomes very, very important. We have also made sure we streamline the mode of communication, because the laboratories, when they get the results, they've got an obligation to communicate with the doctors and the patient, so that they must immediately attend to the treatment that is being given to the patient, as well as also starting to get a list of the contacts that they have. So we've worked well with them. I have noticed somewhere along the line there was an article that referred to that scientists and researchers and professionals are not allowed to speak and so on. I think someone really misunderstood something somewhere, because we would like to encourage you as the media to target our clinicians, our virologists, our specialists for special interviews, because those are the ones who are the source of the correct information about this virus. We rely on them. They are the ones who guide us. They are the ones who also will have to make sure that we follow up international trends, guidelines from various bodies, and therefore they pull them together to enrich our process. All that government does is collect all the reports and make sure that we just release once a day the stats, so that we know for a fact that there's nothing that's falling into cracks. That's all. But the rest of the information is available from our clinicians, from our specialists, from our virologists, from our epidemiologists, all of them, they are available. So I would like to challenge media to actually go all out, to call on them to come and give continuous lectures and continuous explanation and presentations on TV and radio. We are actually, I'm sure you would have heard Minister Lamula. The National Command has asked Minister Lamula to look at how we can deal with the fake news, because fake news does distract. It causes lots of problems. When people begin, you get a formal statement and guidance as to what gets done. One person publishes something that makes people start doubting, and there's no basis whatsoever for it. And we'd like to ask the media also to be very much on the lookout for those, so that they do not inadvertently spread the wrong message. When you come to a situation like this, there has to be one message. And therefore, at the moment, political parties, churches, leaders at different levels of government, professionals, all of us are talking in one voice. It's important that you must keep one voice, because it's one campaign for the survival of the whole nation. So our approach, therefore, is that we will continue the campaign as having been led by the president. It's a whole country campaign. We actually are trying to intensify all our actions insofar as this is concerned. So I'd like to leave it at that for today, and I'd like to ask if Premier could also give her own comments on this matter, and then we'll take a couple of questions as usual, and then move on. Thank you.
Thank you, Minister. Okay, thank you, Minister. I'm sure all of us we know now the Free State is the highest with unemployment. And if Free State is the highest with unemployment, it means that most of the people of the Free State are very poor. And indeed, Free State is amongst the provinces that are very poor. And I'm sure you're quite aware the Free State were affected by the drought. Most of our people don't have water. Besides that, in the Free State, we have 147 informal settlements. You can just imagine 147 informal settlement equals to how many people. So after I was briefed by the minister, and I understood very clear how serious it is, this thing is. So I took a decision to say all big activities are going to be cancelled, because I thought it's going to take us 2 to 3 months, but I've learned this thing can take us the whole year. And after seeing what is happening, I realized our people in the Free State are in danger. So we have decided that this year we are not going to have the Makufe. It's going to be very dangerous for our people. This year, the activity that we love so much, Flower Festival, we are not going to have that activity. This year, the celebration of June 16 is not going to happen. The celebration of August month is not going to happen. In fact, not only those ones, I'm just mentioning few, but big activities that are supposed to take place are definitely not going to happen. Instead, we are going to take that budget to go and assist our people. We are going to take that budget to make sure that we are going to have more gloves, more sanitizers, we more assist our people in the informal settlement about water, maybe start to give them boreholes, but definitely that budget is going straight to assist our people to fight this war of this disease. We have no choice but to protect our own people. And I want to say to Batubabo Ronaba Free State, yes, it is here now. Yes, it is with us now. And indeed, more people are going to be affected. But please remember, we must not panic. We must remember that we are going to turn our houses to churches. We are going to pray in our houses. And all that we must do now is for us to be strong, is for us to be united, is for us not to lose hope. God will never just leave us like that. I have said it before, we will survive. Thank you very much.
Yeah, can I just add one thing? Thank you very much, Premier, that people must not panic to the extent that, we say 80% of the people might have these symptoms and not even need to be treated in hospital.
Yes.
So just be aware of that, because when we say the infection is here, we're saying be aware that it's going to reach all of us, but when it reaches us, how we manage ourselves is how we're going to be able to deal with it. So far, there's no one who has died in South Africa, and we have actually, at the moment, we've got 2 people who are recorded as recovered, and so we will actually, with time, be seeing a number of them getting discharged. And so it's important for us to know that this will, at some point, will end up being like one of the flus. Just that once we get over the familiarization phase, when this virus, our bodies begin to deal with it, scientists can find evidence in your blood that shows that you've got something we call antibodies, immunoglobulins, that have actually dealt with and destroyed the virus themselves, even if you don't treat it. So that's what you need to understand, that all we're doing is that we manage it so that your body can be strong enough to defeat the virus. So everybody can do that, and if you have underlying conditions, that's when you need assistance. When your body's immunity is lower, that's when you need assistance. That's the 20% that you must really look at. So at the end of the day, it's not like we're sitting here, we're seeing this disease that everyone is going to die. No, it's not going to be like that. It's not going to be like that. And so people must just understand that the virus is slowly seeping into all nations, and that not all the people are going to be needing even hospitalization. As long as we understand that we are saying, let's make sure that we delay it so that many people with mild symptoms can recover without needing assistance. I think that point is important, so that when we say don't panic, we are not saying that this is not serious, but we are not saying you don't do anything. We are saying we can manage this situation as long as we use the correct information. I just thought I must just re-emphasize that part. But if the other members want to make comments, maybe they'll answer questions.
Answer questions.
Should we take questions?
Yes.
Can we take questions now? Thank you very much, Honorable Minister and the Honorable Premier. Can we take questions? One, and then two, three. That's the first round. You mention your name and the media house you represent. Thank you.
My first question is just on clarity. You mentioned 5 cases that were reported in the Free State, people coming from countries such as France, and a state such as Texas in the US. They tested positive, and they were quarantined in the BNB. So does this mean the Free State has actually not reported only 1 case? How many cases are there in the Free State?
7. 7 cases. 5 who are travelers from outside. 2 who are South Africans. 1 is a male who had traveled out. The other one is a mother.
Can we take another question?
Sirs, my name is Sesona Ngakamba from News 24. Minister, just a couple of questions for you. The first one being that how sick are these people that are testing positive for this virus? I mean, are they in ICU? Can you describe how is it serious? Are some of them under ventilators? And also, another question is the VIT student, we believe, has she or she tested, has the results come back, and have they come back false positive? What is the situation there?
Can we take the last one? Yes, ma'am.
Minister, it's Aphumelele Mzalane from SABC News. My first question, Minister, if it's possible, we'd like to know the total number of the localized cases and also the people who have traveled abroad. And second question, Minister, you just also made some clarity on the issue of people that the possibility is between 60 to 80%, but we have seen that has brought some panic, taking from social media, people are panicking. If you can just clarify that you are saying between 60 to 80%, the number of people will be infected with this virus, but if you can just clarify the symptoms that people have to expect on such cases. And also we see the increase. What process people need to do to get tested? Are we equipped enough in our private and public hospitals to deal with the increased number?
Thank you very much. Minister, we can.
Okay.
Thank
you.
Can I raise something?
Yeah.
If you don't understand coronavirus, I think the minister must spend a little bit of time, that he must explain how people get infected, so that you can understand how long that virus can stay with you. Why do you have to be quarantined? It's very critical, so that questions when you go and explain to people, you formulate your article, then you are sure that what are the content that should be. I just wanted to raise that, Minister.
Thank you. Okay. Let me start with this figure. There are many viruses that are affecting people. And a lot of them, people are completely unaware of them because they are so common in their distribution in our society. Those viruses they would infect the individual, and the body generally deals with them. And most of them, we don't even go to use antiviral treatment for them. They burn themselves out because the bodies tend to destroy them, the bodies themselves. So scientists would say that the numbers of people who will get exposure to the virus would be very large. The number, in this case, they're not talking about South Africa, they're just talking in general. In any part of the world, the number can go as far as up to 60%. It's a scientific postulation based on observation that that's what would happen. And a number of cases, because of that, a virus that can cause a problem in society where it gives you flus and colds simply because it is there, whereas before end of last year it was not known to be affecting people. So what we are then explaining is that when you deal with epidemics, you need to understand that the virus can go and affect many people, even it can go up to about 60%. But it doesn't mean that those people are going to die. It doesn't mean that all of them are going to get it at the same time. It doesn't mean that we have now got an apocalypse. It basically means, let's just be realistic about the fact that the virus is slowly adjusting to be part of the numbers of viruses that will affect human beings. So there's no need to panic about that, because each time we say anyone can get it, now, some people mustn't start thinking that I'm saying, well, it means you are going to get it yourself. But it means that it will come at some point. That's what we're explaining. And then in the process, we're saying again, in terms of looking at the epidemiology of the disease, you want to always make sure that when we study the way the diseases happen, the disease must be, we must avoid that the disease must rapidly rise, because if it does rise rapidly, it overwhelms your health services and therefore you have more problems. But if you take certain precautions, it means as the virus is adjusting to humans, it will be spreading from person to person. But because of hygiene, it won't be moving fast. Because we are watching the distances and so on between people, it won't be rising very fast. So it's not just something that people must fear. But you see, when you deal with diseases, you need to be given the correct information so far as how the scientists look at it and what the information they make available, so that we must have a sense that there is a way. So when we talk about flattening the curve, we're basically saying if we do nothing, this infection can rapidly rise and affect many people, and then it can overwhelm the system. But all these steps that we have taken means we can actually slow the virus down such that so-and-so will have it, they don't even look serious about it, then it gets, the body destroys it, and thereafter it's gone, and then someone else gets affected. And over a period, many people will have actually recovered from the virus without any of them really requiring a lot of attention, as it were. So many people will actually have the virus, and then they will not have really had serious illnesses, as it were. That is important because the way the virus is being described, if someone gets exposed to the virus and inhale it or it gets onto their body, they can get symptoms within 2 days up to 14 days. So anytime there, they can actually develop the virus. It depends on the body, how it deals with the virus. Secondly, as soon as the symptoms start, the person becomes infective, which means anyone who comes across them will can actually contract the infection. Thirdly, it means also that when the person, if you just kept the person to themselves and they are not dealing with other people, then what it will then do, it will then the body will destroy it, and it will cause what we call viral shedding. That means it gets out of the body cells, bit by bit. But by 14 days, the body will have, most of the people, it would have shed off the virus. So after 14 days, even without treatment, you will have no virus in your body. So when we test you on day 1, we find that you've got you're positive for the virus. When we test you on day 14, maybe you might find that you are no longer having the virus. That means your body has dealt with the virus and sorted it out. Then for an exceptional 20%, those will need to be in the hospitals. Now, those people will go to the hospital. Many of them will be treated because they've got other underlying problems. They'll be treated. And very few will end up in intensive care. Generally, it tends to be those who have got other concomitant diseases. And this one is an opportunistic one that just makes it worse for the individual. So that's how we're looking at the virus. So now, people mustn't now cause panic by saying, oh, it means anyone can get the virus. Of course, this is a virus. You can't stop it from affecting anybody. But we are saying if we manage it together, the symptoms may be such that you don't end up with an infection that will need you to be hospitalized, and therefore we can reduce the numbers of deaths, we can reduce the numbers of people who have got severe infection. That's what we're aiming at. And when we say we want to flatten the curve, we're saying as more people get the infection, it must be over a longer period so that they don't have to all rush to get the attention at the health services. There are people who are going to have the infection and have minimal symptoms and recover and may not even know if they had it if we didn't actually even test them. So those kinds of situations are such that the virus can actually be contained by the human body. The only difficulty that China had was the fact that when it started, it was not well known. So when people were sick, they were put all in hospital. Now the virus spread on people who had other diseases, and then it caused them more problems. But once China decided to put the people with the virus separately, it actually reduced the deaths. So that's what you have to understand. That's the main thing. Then the issue that relates to the total numbers. I think somebody asked the question about all the people who are sick. None of them are in the ICU. They've been taken to hospital simply because the doctors must assess them there. And a few doctors have reported the patient, they've been complaining, but we are not sick. Why are you keeping us? And so you must just understand that the doctors have the free rein to see how they treat the patient. If they decide that the patient will be admitted, they'll admit the patient. But on most of the patients that we've got right now, they're actually improving. They don't have serious symptoms. There was only one instance where someone had an underlying renal disease, and that person was really more in trouble because of that problem than because of the virus. And so we don't have anyone who is in a critical state as we speak now. What we want to try and do is to make sure that whatever numbers of people that we've got, they must be generally having milder symptoms, and they are treated quickly and they get out so that we don't have too many people coming to the hospital. But we have made provision for more beds to be made available in case we need to admit more people into our hospitals. We've also spoken to the public-private sector to start looking at the numbers of private beds, also of private hospitals with ICUs, so that in case we reach that point. Right now we're having 200 people. None of them require ICU, none of them require intensive care unit, none of them are so serious that we are really very worried about them, but we are very seriously watching them so that we want to make sure that they get better. So that is the situation. Now, the VET student was tested on the first day. Then when the test was checked the second time, the student was negative. We went through all the steps to check if there was any problem. The only scientific explanation for the change of his results was clinical recovery, which meant that if today you have the virus and the body is busy shedding the virus, you can find that if that was your one day, the following day the virus would have disappeared in your body. There is no need for us to go to tests that would have to identify whether in fact there is record of the virus in the body. It can be done. That's what I was talking about, where the body will have to check the presence of antibodies, immunoglobulins. There are groups of immunoglobulins, immunoglobulin M, immunoglobulin G, that will be, depending on the time of exposure, you can still find in the body. In this case, it's not clinically indicated, so there's no need to do that. All that you needed to know is the patient clinically well, or is the patient needing treatment? When the patient is clinically well, then the last test you had was positive and they're clinically well right now, therefore your next test is negative. You're now combining two factors. One, clinical wellness and improvement, which is important. Two, serological negative test. That means that these two are saying to you the patient is no longer at risk of infecting other people. It's dealt with the virus, we're fine with it. Then we're going to be dealing with others. There's going to be a lot of instances where there are unclear behavior of either the virus or the individuals in terms of manifestation. There's a lot of scope for research so that you can learn a bit more about the virus. So we're not spending too much time worrying about that student, because the student is well. The real indication for us to worry about the student is if the student was sick, then we'd have to go into all these other tests. Because if the student was very sick, then there would have to be a question that says, was it COVID-19 in the first instance? If people were now worried, they can then do the antibodies and then exclude that and come back to look for other causes. Now, right now, there's no need for that because the patient was well. So the doctors have satisfied that no, they're happy with the patient. As long as the doctor is happy with the patient and the patient is happy with themselves, we're also fine. So that is really what we would then say to you. If you treat patients, you're trying to prevent death. When you test patients, you're trying to prevent death. When you get a doctor to look after the patient, you're trying to prevent death. When you are providing hospital beds, you want to try and prevent death. When you provide ICU and ventilators, you're trying to prevent death. We've done all of those things. We've not had to need to take anyone to ICU, because the role of the health services, the role of the health professionals, the role of the health support institutions such as laboratories and radiology and so on is to facilitate diagnosis so that we can treat the cause of ill health and prevent death. So the Department of Health is about prevention of unnecessary death, because if you can treat and cure someone, then of course that's our first prize. So at the moment, we do not have any patient that has succumbed to the coronavirus. And therefore, all that we have been doing is to be able to move far ahead to try and make sure that we limit the impact, negative impact of the infection. Let me leave it at that in terms of the questions.
I take it that that was pedantic.
Thank you.
Sufficiently clear, succinct. Can we then agree that we have come to the end of the media briefing.
Thank you.
And
But I just want to ask Ore, Bona, do they really take these things serious? Because I've been with them the whole day, but I've never seen them using any sanitizers. I don't know, so you must be careful, you yourself. You must start now to take this thing very serious.
you want to attest that you've used the sanitizer?
No, we're starting a meeting now. That's fine. This is a motherly advice.
We've
Thank you.
come to the end of the media briefing. I think the last comment of the Premier was just emphasizing the messages that we must walk the talk. We must not be disseminators of news for things we do not do. Let us do likewise. Thank you very much.
I leave it.
Thank you.
Don't disseminate information that we don't know.
No, I think this was good. It was very good. Oh, thank you very much.